Recovery from RSI is really difficult. You can try so many different things, follow everything your doctor tells you, and still, you may be stuck with pain, inability to work, or enjoy your hobbies. And if you're here, you may have realized that there's probably something missing in these solutions that you've tried. I'm Matt, and I'm a physical therapist who has specialized in RSI over the past decade. I've published 2 textbooks, a few studies, and have helped over 3,000 individuals resolve their injuries through addressing the actual underlying causes. That means no surgery, no resting, no bracing, no icing. And over the past 10 years, I've learned why it is so hard for us to recover. You are not getting the care that you need, and you aren't being evaluated thoroughly, and because of this, you're getting band-aids rather than solutions. Repetitive strain injuries themselves are pretty simple, but they can become complex because of poor care. Now, today I'm going to share with you what should be done with your healthcare provider and why. Now, I want you to think about your doctor's visits. What questions did they ask? What tests did they perform? And most importantly, what did they teach you about those results and how it relates to your specific life and activities? Now, here's what should be done in those situations. I want you to see if there's any gaps and feel free to share in the comments. Let's start with the beginning, the patient interview. The quality of an assessment is directly associated with the outcomes of a patient. And it always starts with gathering a comprehensive picture of the individual, which can include medical history, symptoms, symptom behavior, and more. Now, here's an overview of what we ask about during our patient interview, which typically lasts between 15 to 30 minutes, depending on the complexity. We first start by trying to understand where the pain is and how it behaves. This can clue us in on the potential tissues that are involved. So we might ask questions like, where's the pain? How large of an area is the pain region? Is it more focal? Is it more diffuse? How does the pain behave across various situations? Does it seem like it's actually moving across different regions? Are there specific activities that might make the pain worse? And what has been helpful to alleviate those symptoms? Are there maybe presence of nerve symptoms? Based on the evaluation and presentation of the numbness and the described positions that increase the numbness, would it be based on some entrapment at the shoulder or the neck? So what is the medical history of the entire condition? What medications are they taking? What medications have they taken? Is there conflicting information that needs to be addressed based on the previous doctor's visits? What procedures were done? Imaging that was done? Did the doctors actually explain the results in the context of the actual assessment? And what exactly did a previous physical therapist, occupational therapist, or other healthcare provider do with the patient? How many sets? How many reps? What exercises? Why did they do the exercises? It all matters because then we can figure out why those past solutions were not helpful. And most importantly, what is their understanding of what is going on based on their healthcare visits and their own research online from what they've learned. We need to also evaluate the psychological and social factors that could be contributing to their pain. So it could be exploring what is their actual understanding of pain. Do they have any risk factors associated with central sensitization, like fear avoidance, kinesiophobia, catastrophization? Do they have poor coping strategies? Do they have any signs of sensitization? Does it feel hard for them to describe what they're feeling? Does it just this general sensation? Do small things that don't typically cause pain cause a lot of pain? Do they have extreme sensitivity in that area? These are all some of the signs that there may be some central sensitization. Do they have job-related stress or high occupational demands? And what have they dealt around work recently that may be affecting them psychologically? And then there's more direct questions about their work, schedule, and lifestyle. So what is their daily and weekly schedule from the moment they wake up to the moment they go to bed? What is their work schedule? When do they take breaks? What does their first session look like? How do they distribute their actual work time when they're dealing with an injury? And if the activity is related to using a specific tool or instrument or input device, how are they using it? What's the posture and ergonomics with those devices? Is it a fingertip grip? Is it a claw grip? Is it a palm grip? Are they doing a calligrapher's grip for a pen? How are they holding that tool? Basically allowing us to understand the posture and ergonomic contributions. And outside of work, how much additional time are they using their wrist and hand, maybe on the PC, the phone, or their other hobbies? And then what strategies have they used to try to modify that activity? Are they exercising currently? What have they done previously with rehab exercises? And What is it that they experienced and why? Why did they think that it didn't help? And additionally, we have to clear for red flags or other systemic symptoms. So things like nausea, weight loss, traumatic mechanism of injuries, systemic flags, all of those need to be cleared. But most importantly, we actually have to understand their goals. What is their goal with our visit? And what do they believe is their version of 100%? The interview is revealing and helping us understand not only what tissues we want to selectively test for. Now, this is a lot of questions, and it's actually very revealing in helping us understand what tissues we want to selectively test for, but if there's also any psychological influences of pain or red flags. Usually where the pain is located and how it behaves with respect to certain activities will point us towards specific muscles and tendons to test. Of course, if there's nerve symptoms, we can identify areas of entrapment. And based on certain responses, it can rule out the need to ask more in-depth questions. This is why healthcare providers have to study so much to understand certain responses, symptoms, and statements, what those mean with regards to an individual's health. By the end of the interview process, a good provider typically has a good understanding of what's going on and uses the objective portion, the testing portion, to show the patient what may actually be contributing to the problem. And hey, by the way, if you haven't experienced this level of exploration into your issues, right now we're offering a limited amount of free consultations that you can book right below. We'll explore more about your specific case and determine what the next best steps are with your injury or issue. Click the link below, answer the questions about your issue, and set up your free call with us. See you there. Now, following the interview, it's important to confirm the hypotheses of what we are actually thinking with actual tests and show the patient. Are you weak? Are you tight? Do you have some potential sensitivity? And often the difference between an expert and a generalist for certain conditions is the appropriate selection of tests to rule in and rule out. So here's an overview of a thorough objective assessment. The interview itself determines which tests are going to be performed. Certain physical tests can also be performed to rule out certain conditions. So what needs to be done is evaluate how they're actually moving or performing their specific activity. Are there any ergonomic or postural contributions that would biomechanically lead to an increase in tissue stress on the suspected tendons that are involved based on the behavior of the symptoms? What is the pain level at rest? And with the modification of those movements, does it reduce stress or change symptoms? Then we do selective tissue tests to rule in muscles, tendons, nerves, or rule out certain muscles and tendons and nerves. And this is actually where you often see the difference in skill for certain physical therapists. You don't need to test everything under the sun. You can actually be a bit more specific. I say sniper versus shotgun. A sniper means they only need to test the things that are necessary. And this comes with time and expertise. Whereas a shotgun, they test everything under the sun. Or they don't even know what to test. Now we then have to functionally test the individual in a position that we know will increase the pain to see if it behaves similarly to what was discussed. And if there's a discrepancy, sometimes there can be psychosocial or perception problems. Then there's all those special tests that we can do to rule in, rule out nerve joint ligaments, endurance testing for specific muscle groups, mobility testing for specific muscle groups, comparing those to normative values. And I truly believe we may be the only group that has these normative values for all the muscle groups of the wrist and hands for muscle endurance or tissues capacity. And I think this is just because we've been fortunate to work with so many patients with RSI to establish this normative data based on varied amount of demographics, but a lot of the individuals that repeatedly use their wrist and hand, desk workers, gamers, artists, crafters, musicians. And so performing those objective tests that we have and comparing it to the normative values to determine where the patient is and where they need to be. Because we don't need strength for RSI, we need endurance. And of course, also assessing form and biomechanics of exercises they've performed previously. By now, we have a pretty complete picture and can begin to treat the patient. And treatment should always involve patient education. And I think this is missing a lot of the time in traditional environments because they just don't have time. Our goal as providers is to not only identify what's going on that may have led to the problem in the first place, but help patients understand why their physical health approach, their lifestyle, their understanding of pain led to where they are now and why it caused the problem in the first place. And the idea is that the lifestyle, physical conditioning, and understanding of pain is probably the reason you're still currently dealing with some functional limitations. And what we educate the patient on will of course be heavily influenced by all of the answers, all of the objective tests, but here's a brief overview of the things we educate our patients on. Of course, exercise to address any of those physiologic deficits, how to integrate those exercises into the lifestyle, helping the patients understand the combination of the physical, mental, and lifestyle factors that led to the initial problem in the first place and their persisting disability. We provide metaphors to explain more complex physiology and even necessary pain science concepts. Then we have to help the patient understand the relationship between posture, ergonomics, their lifestyle, and everything with regards to what they're feeling, and how they need to gradually change all of those things since it likely led to their problem in the first place. The overall session is as long as it needs to be. If it's simple, it's often 45 minutes to an hour. If it's complex, it can be at most 1.5 hours. And what is non-negotiable for providers is that the patient understands what's going on. The patient can and should challenge providers at the end if they have doubts or don't agree with anything they've been presented with. So the healthcare provider can actually provide the rationale. We have to be accountable to be able to provide the rationale for why we're prescribing certain things, and also provide the evidence and the reason why we're taking that approach. And just like anything in life, a good provider will save you time and money. I've created a lot of content about how much patients typically already spend on traditional healthcare, considering their deductible, visits, interventions, ergonomic equipment, etc. On average, it's around $1,000 to $1,500 by the time they get to us. But let's be realistic about the other aspect of care, which is trying to solve it on your own. In many cases, we know individuals try to resolve things on their own. And part of the reason why I keep posting content is so that individuals can leverage our systems and our information, our education, to try to solve it on their own. And why we even built an app for this. But as I said above, it's not easy to do on your own. You definitely can be successful, and you can also see other physical therapists who might help. But hopefully you can see that it's not easy when there's so many variables and details to consider that can influence your recovery. And being realistic, ultimately it's about speed and likelihood of recovery when it comes to trying things on your own. There's just a lot more trial and error. You can try something and you might experience an increase in pain, and you just have to figure out for yourself what was the actual cause of the increase in pain, whether it be physical, mental, or lifestyle based. And you can get really easily confused since there's so many resources online. It just takes a lot longer than if you had an organized, systematic approach on day one. And so naturally, I just believe working with a good physical therapist or provider helps save you time, money, and frustration. I'm proud of the outcomes we've been able to achieve with RSI and have a firm belief that we truly provide the highest level of care when it comes to these types of injuries. The main lesson here is just find a good provider. What I shared should be the standard of what you get from a physical therapist. And you might guess, this is the level of care that we provide. Now, I hope this helps put into perspective why it's so hard to recover from an RSI. There's just so many variables. And like I said, if you're interested in working with us, you can book a call for free to see if we're the right people to help you with your specific case. Just check out the link in the description. And if you want to learn more about all things RSI, all the science behind RSI, check out this video right over here.